Good morning. My name is Scott Lundstrom, and I'm here at the Healthcare IT Summit in Palm Springs. And I've just finished a talk that we call the Decade of Disruption. And really what we're trying to do is capture a discussion of the business changes, the risk changes, and the infrastructure changes that the healthcare marketplace is going to have to embrace over the next decade. I think, the biggest change that healthcare organizations are facing is this idea that now they have to take on risk. They have to really begin to look at the efficiency of process, the quality of care, not just as ethical or moral goals, but as real requirements to running a successful business. And this is a huge change for payers and providers. So I think, there are lots of different ways to look at this, but the investments seem to pretty consistently fall in a couple areas. The first is really to begin to take ownership of your data and manage it. The problems this market faces are not going to be delivered by a claims vendor in the payer space or by an EMR vendor in the healthcare space. What's really required are these integrated analytic programs that allow us to begin to bring together clinical information, financial data, and risk information to really determine what is the next best action for a particular patient, both from a health and from a business perspective. So a couple. The first is this idea of taking risk. Okay, we all have skin in the game now. A healthcare provider is going to receive a global payment. A healthcare provider is going to manage patients kind of as an annuity in the patient-centered medical home. And what this really means is that we have skin in the game around quality. That if we can't produce a quality outcome, if we can't reduce readmissions, if we can't reduce medical errors in our facilities, we're not going to be successful. And that's really forcing healthcare organizations to begin to think out of the box, to look at how other industries have dealt with these challenges, to look at other architectures. I think for many payers and providers, they hope that one of their suppliers would deliver this. And I think the harsh reality of the market is you're going to have to stand this up on your own through partners, through service providers, through your own activities, if you want to be successful. Sure. So, and every healthcare organization is going to have to strive to do this as part of better delivering care and better managing risk. So what we're really talking about first is the ability to consume information, to actually process analytics and process information and come up with kind of a next best action for the patient. We have to communicate that to the patient. We have to coordinate the actions that come out of that. And we have to collaborate on next steps in the process here. And really, the challenge of what's going on here is we have to move from kind of these incidents of care, where a patient comes in and gets service and they leave, to more of a continuum of care, where we're really managing the wellness of the individual over longer periods of time in a much more inclusive way. And really a tough row to hoe, I think, for many of these organizations. The challenge is that we're resource constrained, we're capital constrained, and yet we have to make tremendous strides forward. We have to make bigger changes in the IT architecture over the next 5 years than we've made in the last 15 years. Typically on, again, this kind of declining resources and real shortages of some of the expertise we need in the mobility space and the analytics space. So, for the vast majority of them, kind of a tough set of programs. And increasingly, we're going to see them move toward service providers as the way to do this. We genuinely believe that the average healthcare organization really is beyond their depth in some of these areas. When we look at cloud, when we look at security, when we look at mobility, very challenging for IT departments really to come to grips with this. And increasingly, we see movement toward service providers, toward capability as a service. And increasingly, we think that really goes down to apps as a service, platform as a service, even infrastructure as a service. When you look at the risk remediation, the quality of delivery, the agility, most participants in the market are going to have no choice but to go to service providers for some of this new capability. And again, I think it really does come back to risk. I think most health organizations have a very transactional structure. I come in, I see my physician, I pay for that visit. This is a classic fee-for-service model. On the payer side, I receive a claim. That's usually the first notification I have. I process that claim. Very transactional. Well, the market really isn't a transaction-oriented market moving forward. It's a market where we get rewarded for managing and improving wellness. That means we have to take a much broader view of the patient. We need to have much more frequent points of contact. We need to consider a lot more data about what's the best thing that we should do with this patient moving forward. And we have to do all of that in a way that increases the volume of care we deliver while reducing cost. And probably the biggest challenge most healthcare organizations are going to have is that change in volume and value. Right? Imagine that you have to double the volume of care that you provide, and you have to do it at half the price. And that's certainly the curve we're on, and many institutions are going to find that a very difficult transition to make.